This is an investigator-initiated clinical trial looking at a primary endpoint of quality of life between two maintenance strategies, Daratumumab versus Lenalidomide. It's a 100-patient study with 50 patients to be enrolled in each arm. Currently, the study is about 85% enrolled, and we present interim efficacy analysis. So that's a secondary endpoint. The primary endpoint of quality of life, we are not presenting at ASH at this time. In terms of the secondary endpoint, what we do see is that both arms have single-agent Daratumumab and single-agent Lenalidomide given after induction and transplant as maintenance, plus minus transplant, so whether they got a transplant or not, showed similar progression-free survival at 1 year and 2 years, and also MRD negativity rates, suggesting that Daratumumab may be an effective maintenance strategy as well as a single agent in patients, especially that may have intolerance to Revlimid or Lenalidomide and side effects.